Hi, I'm Dr. Stephen Melemis, and today I'd like to talk about what is addiction. One of the really amazing things about addiction is that there are strains of mice that behave just like alcoholic humans, which is if you give them one drink leads to more drinks. They have a hard time stopping. And that, after all, is the defining quality of an addiction. An addiction is not how easy it is to go without using. Sometimes people will say, I don't think I have an addiction because I can go for a whole week or a whole month without using. An addiction is how difficult it is to stop once you start using. And that's what these mice do. Once they have one drink leads to more drinks. And here's the really amazing part of this story. If you take these mice and cut open their brain and look at the wiring of their brain, the brain of the alcoholic mouse is actually wired differently than the brain of the non-alcoholic mouse. Right down to their nerve cells and their brain chemistry, the one mouse is different than the other. And I think that tells you three really important lessons about addiction. The first lesson is that addiction is a disease of the wiring of the brain. If it can happen to mice, it can happen to anybody. Addiction is not about how smart you are, how strong you are, or how determined you are. It is about how your brain is wired. And if your brain is wired in a particular way, you will get a buzz from drugs and alcohol that other people just don't get. That's why non-addicts have such a hard time understanding addicts. A non-addict will have one or two drinks and stop naturally. They don't have to think about stopping. They don't have to count their drinks. They just stop. And if they have a few more drinks, they don't even like the feeling. Whereas after 2 or 3 drinks, an addict is just getting started. Why? Because the brain of an addict feels drugs and alcohol differently than the brain of a non-addict. Because their brains are wired differently. So the first lesson of addiction is that it is a disease of the wiring of the brain. And therefore you should approach it like every other disease. If this were heart disease or diabetes, you wouldn't think to yourself, oh my God, I'm an awful person. Instead, you'd probably say, now that I have this disease, what must I do to get on with my life? And that's the way you should approach addiction. The second lesson of addiction is that it is hardwired into you. It's as much a part of you as the color of your eyes are. And because of that, the buzz that you get from drugs and alcohol will never go away. Your cravings will lessen over time. It will be easier to manage them, but even after 1 year of recovery or 10 years of recovery, that buzz that you get will still be the same. You've probably heard of the idea of neuroplasticity, the fact that you can change the wiring of your brain by learning new things. The problem is that you can't unlearn something. Once you have experienced addiction, there's no going back. You can't change the wiring of your brain back to the way it was. So, if addiction is hardwired into you, and the buzz that you get from drugs and alcohol will never go away, the second lesson of addiction is that total abstinence is important for recovery. But here's the problem. After you've been in recovery for 6 months or 12 months, you will think to yourself, this is the longest time I've ever gone without using, and I feel stronger now than I've ever felt before. And surely now that I've learned new coping skills and changed my life, surely now I can go back and control my using. I promise you will think that. Not because you're doing a bad job, but because that's the nature of addiction. And when that day comes, you have to ask yourself, has the color of my eyes changed? Because that's what this is about. So the second lesson of addiction is that total abstinence is important for recovery. Since you can't change the color of your eyes or the wiring of your brain, how do you treat an addiction? The third lesson of addiction is that you don't treat an addiction by just stopping using. You treat an addiction by creating a new life where it's easier to not use. That's so important, I'm going to say it one more time. You don't treat an addiction by just stopping. You treat an addiction by creating a new life where it's easier to not use. If all you do is stop using, then everything that brought you here will eventually catch up with you all over again. If all you do is stop using, then nothing changes if nothing changes. The fact that you have to change your life means that you have an opportunity for change. This is the gift that your addiction has given you. Your addiction has given you one gift, and that is the chance to stop in the middle of your life, reevaluate it, and make some changes. And if you use this opportunity correctly, you can go on and be happier than you've ever been. If you use this opportunity correctly, you can look back on your addiction as one of the best things that ever happened to you. I encourage you to make the most of this chance. Start now to improve the quality of your life. Until next time, I'm Dr. Stephen Melemis, wishing you a healthy and happy recovery.